Hi, I'm Dr. Renée St-Pierre, and I'm a recent graduate from McGill University, and I have been a graduate student member of the International Center for Youth Gambling Problems and High-Risk Behaviors for 10 years now. My research is mostly focused on the risk factors related to youth gambling, as well as some policy-level research. Demographic factors such as age. So the earlier that you start gambling, it's a marker for vulnerability, or it's associated with the propensity to develop gambling problems. Gender, obviously, is another very big one that's been shown that men or males predominantly develop gambling problems more than females do. But there are also other risk factors, such as cognitive risk factors. Those are some that I've been interested in, particularly cognitive biases, so how rational or irrational your thinking is in terms of when you're gambling. Also, outcome expectancies. What do you expect will happen when you gamble? There are attitudinal factors, so your gambling attitudes. Do you think favorably or unfavorably about gambling? As well as some other social factors, such as whether your parents gamble or if your peers gamble. There has not been very much research that's looked into how do these factors connect to create a constellation and then lead to gambling problems later on. There are some protective factors, and that includes a strong bond with your parents, so good family cohesiveness, also parental involvement. So rather than on the opposite spectrum of neglect, we have a lot of parental involvement that tends to be protective factor. Also, school connectedness. So if adolescents or youth are connected to the school environment and have a good role model, either teacher, faculty member, or some type of other staff member from the school, that also can serve to be a protective factor in the face of other risk factors. Starting to talk about these issues, starting in the home environment as early as possible, and getting parents to become aware of these things as early as possible would be ideal in terms of prevention. However, there are limited resources that are available. What works best is generally trying to reach youth at the high school age, when they're starting to, gamble more with their friends and doing these types of activities. So within pre-adolescence and adolescence, and going into the schools and integrating, not just talking specifically about gambling, but talking about all types of high-risk behaviors, because they tend to have many of the same types of risk factors. And so integrating a gambling prevention program within a larger prevention program and going into the schools and teaching them decision-making skills, problem-solving skills, ability to resist peer pressure, because those would be useful across the board, not just for gambling specifically, but also for alcohol use, drinking being a big problem later on in college age, drug use. All of these things would be critical, I believe, at that age. However, the issue is right now, many of the available gambling prevention programs, with the exception of Stack Deck and a few others, have not shown that much of efficacy in terms of changing gambling behavior over time. And so there's still a lot of work that needs to be done in prevention.